Hi, Kurt MUNOZ here, physical therapist at Balance Physical Therapy, here to talk to you about ankle sprains. So ankle sprain, what is it? An ankle sprain is quite generally just an injury to the ligaments that support the bones of the foot and ankle. So oftentimes when we're playing sports, walking, we roll the ankle, most commonly inwards, but that can cause some injury or a little damage to the ligaments that support the foot and ankle. So how do we treat that, or how do we go about making sure we have the best healing? Well, we used to think that rest, ice, and not putting any weight on it was the best strategy. Now, with a better understanding of the healing process, we know that we want to have gentle movement within a range that isn't extremely painful. So we want to get the foot and ankle moving in all ranges of motion or all planes of motion that we can tolerate. Then we want to start to put weight on it. We want to start walking on it as much as we can without causing that extreme pain. We do want to use certain strategies to help with inflammation, like elevation, maybe some compression, but we don't want to just ice and not move it. Otherwise, we actually reduce the blood that gets down to the ankle and increases the healing. So our general strategies are gentle movement, walking as tolerated, and then just give it a little love with some heat or some compression and elevation. All right, thank you guys.